Hi, I'm Amy from Pause to Remember. I gave a grand rounds presentation to some advanced practice professionals, sharing some of the literature that I've been reading regarding pregnancy and infant loss amongst healthcare providers, as well as infertility and major pregnancy complications. Interestingly, there were no journal articles that I could find specifically looking at the issue of loss amongst nurse practitioners, physician assistants, or CRNAs. So, with permission from West Virginia University Medicine, I downloaded the recording of the presentation. It's about 30 minutes long and ends with a little meditation for you about things that I have found and just raising awareness about this issue of loss amongst providers. I hope you enjoy the recording. I will put some links in the show notes. So if you want my information with links to the research articles that I have put into this talk, you can get it. Thanks for being here. Statistically, about 25% of you have experienced pregnancy or infant loss. And as healthcare providers, the statistics are not in our favor. When we think about family, it's a big part of our well being. And with the pandemic and being short staffed and the challenges that we're experiencing, our well being is already being stressed. So when we think about choosing our career, we don't usually think about what it's going to be like to conceive and have a family and grow a family. Because as undergraduates or even in our graduate program, that might not be on our mind. But statistically, we are actually having a harder time getting pregnant and maintaining healthy pregnancies and having viable babies. And the ripple effect of this loss is not only within our families, but it's within our departments, our patients, and our communities that are being impacted by this. So I'm here today to start normalizing some of these difficult conversations around loss within us as providers. Full disclosure, I have founded an online community supporting healthcare providers grieving after pregnancy and infant loss, and it's called Pause to Remember. So, why am I here today to talk about this? It all started with personal experience. My husband, who's also a CRNA, and I were offered in vitro fertilization when I was 34. We decided not to pursue that avenue, and we decided that if things didn't happen naturally, we just wouldn't be parents, and we were okay with that. About a year later, I was pregnant, and I did have some complications with my pregnancy, including hypothyroidism and contractions that started at 18 weeks. And those contractions were primarily on days that I worked towards the last few hours of my 12-hour shifts. And I ended up having to reduce the length of my shifts and then drop to 30 hours a week because of the contractions while I was pregnant. And then we did have a healthy baby boy. He did have some dairy and soy intolerance, and that was definitely a stressor. But just overall, I did have some postpartum issues, and I finished up therapy for that at age 37. Our daughter was a little bit of a different story. She was stillborn a day shy of 22 weeks right here at WVU. I had wonderful care, and I was 41, so I was an older mom. And kind of every worst case scenario that I had ever feared happened. And despite having a really great support network, not only within my family and friend network, but also from my colleagues and the department resources and the hospital. And I was really lucky, and I had a wonderful therapist from my postpartum issues that I tapped right back into. But despite having all of this, it was so stressful. And the stress of that landed me back in the hospital 7 months later to rule out inflammatory bowel disease and continue to have problems with hypothyroidism. I did get that all under control. Mindfulness was a big part of that. But despite that, I did find myself in a point of burnout when I was 43 because I poured myself into work as an outlet for some of this grief. With that being said, I just want to come here today and identify some of the healthcare provider risk factors for infertility and pregnancy loss. And I include infertility because that is a big loss, just like pregnancy and infant loss. And I want to identify a lot of gaps in the research and data. I want to explain how we can work through loss using mindfulness, compassion, and connection, and what we can do as departments and as institutions to support the providers who are serving our communities. To begin with infertility, this is just not a female issue. This is a male and a female issue. Just like pregnancy and infant loss impacts both parents. Causes of infertility and loss include, we're going to break them down into three parts: medical, environmental, and health and lifestyle. So we've all got medical training. So we know that genetics, hormone imbalances, health conditions like diabetes, hypertension, obesity, autoimmune problems like lupus and celiac can impact our fertility and our pregnancy course. And medications such as retinoids, chemotherapy, and autoimmune drugs can also impact that. Environmental, I want you to really pay attention because this is different for the general population. We are exposed to so many chemicals, such as cleaning and sterilization agents, radiation with our X-ray, fluoroscopy, CT scans, and medications, whether we're mixing them up or we're caring for a patient who, for example, soils themselves and they're on chemotherapy and now you're getting exposure. If you're in the operating room, anesthetic gases is also a concern. And we're also exposed to torch diseases. Torch stands for toxoplasmosis. Other infections such as HIV, hepatitis, Zika, COVID, R for rubella, C for cytomegalovirus, and H for herpes simplex virus that all puts us at higher risk. And health and lifestyle issues. So most of us are conceiving in our 30s and 40s. We are working rotating shifts and nights and taking call. We work in stressful jobs. Many of us have nutrient poor diets because we're just eating on the go, trying to go. And we find ourselves in a sedentary lifestyle, sitting in front of an electronic medical record, trying to chart and get everything done. And we too are human. Some of us have alcohol, smoking, and drug issues that can also impact fertility and loss. So if you start looking at the demographics of advanced practice providers, between 83 and 98% of us are age 30 and older. This is important because fertility starts to decline in our early 30s. And by 35, we are labeled advanced maternal age if we become pregnant, because our age impacts our ability to have a healthy pregnancy and conceive. At age 37, our fertility rates more rapidly decline. So, what does the literature tell us about it? Unfortunately, I can't find data for APPs in particular, but I can tell you that our physician colleagues are really paying attention to this and starting to do a lot more research, and they're talking about it. So here's a couple articles. We'll start with Physician Fertility, a call to action that was released in 2020 in Academic Medicine. And this group identified infertility. So it used to be thought that infertility affected about 1 in 8 couples. And more recently, that number has dropped to 1 in 6 couples in the general population. But if you look at the data amongst American physicians, their infertility rate is 1 in 4. This leaves physicians involuntarily childless, and this leads to emotional distress, personal devastation, isolation, guilt, burnout. And without even having fertility or problems or loss, burnout is a problem just baseline where we're at today after the pandemic and with our staffing issues. And fertility creates a great financial burden. If you look at the cost of infertility treatments, most couples spend $17,000 to $20,000 per IVF cycle, and some take up to 5 cycles to have a live birth, or about $100,000. So this group in the study called for an increased awareness and education, and that needs to begin when we're undergraduates and we're starting to plan out our careers. And the thought about preserving our eggs or doing cryopreservation when we're in our 20s. It also called for insurance coverage for all healthcare providers for infertility treatment because this problem affects us more than the general population. They call for flexible work hours and time off because fertility treatments are so tight on such a tight timeline that you can't miss appointments and tests and procedures. And they also recommended more resources for counseling to support the emotional toll that this all takes. and to have written policies with leadership support for all of these things that they're calling for. In JAMA Surgery in 2021, this group of female surgeons, most of them who had experienced loss, came out of Brigham and Women's, and they titled it Incidence of Infertility and Pregnancy Complications in U.S. Female Surgeons. You want to take a guess what the rate of pregnancy loss was amongst the 692 surgeons, female surgeons that responded? It was 42%. In the general population, it's estimated that pregnancy and infant loss is somewhere between 15 and 25%. So this is double the average in the general population. So if you look at the breakdown of that 42% pregnancy loss, about 85% lost their babies before 10 weeks, about 32% between 10 and 20 weeks gestation, and then 3.8% had a stillbirth. If you look at the CDC numbers, about 1 in 175 births are a stillbirth. That comes out to be 0.57%. So the surgeons are experiencing a very statistically significant more stillbirth rate than the general population. They also talked about major pregnancy complications amongst the surgeon group. 48.3% had major pregnancy complications, things like preeclampsia and placental abruption, compared to about 27% in the general population. So let's talk about night shift, rotating shift, fixed shift, and taking call at night. This group published a paper in the Canadian Medical Association Journal in 2019. And they said, is the culture of medicine contributing to miscarriages among female physicians? And in their study, they looked at just under 300 physicians, and 51% had a miscarriage. So that is twice the rate of the general population. They found that rotating or fixed night shift and longer hours of work increased the risk of poor pregnancy outcomes. And that included miscarriage, preterm delivery, small for gestational age, low birth weight, preeclampsia, and hypertension. I quote from this study, dose response analysis showed women working more than 55.5 hours versus 40 hours per week had a 10% increase in the odds of having a preterm delivery. So flipping over to our nursing colleagues, this article in 2014 was published in Birth Issues in Prenatal Care. Do nurses have worse pregnancy outcomes than non-nurses? And they found that in this study, nurses were higher risk for C-section, needing tocolysis, and preterm delivery. So what do you do if you are experiencing infertility or you've had a miscarriage, stillbirth, ectopic pregnancy, had to terminate for medical reasons, molar pregnancy, I could go on, or had an infant loss? First, I am here to tell you that you are not alone. This can be an incredibly isolating experience, and you're not alone. Everything that you are feeling is very real. And we are trained as providers to provide support to our patients and to our communities. We are not trained to ask for support. And this is the time to do it. It is the time to exercise self-care and to remember that there is no timeline for grieving. It doesn't just magically go away after a year. It's something that you carry for the rest of your life. So support and options if you find yourself either dealing with fertility issues or you've had a loss. First, talk with your manager and or HR representative. If you're having fertility treatments, ask for flexible work hours and time off so that you can make all those appointments. Limit your night shift and call, and eliminate overtime and working more than 8 hours a day. Consider going to therapy. I can't stress this enough. So, in addition to the emotions that come with grieving and loss, sometimes past traumas or difficulties in the past can resurface when you've had a loss. Journaling is a really helpful way to track your progress and get some of those feelings out on paper. And get outside, get out into nature, exercise, have some massage therapy, and start exploring information in books and podcasts. There is a growing number of podcasts out there discussing this and normalizing these conversations. Support groups is a nice way to go, and mindfulness practices can be incredibly helpful. And I can tell you from personal experience, they've been very helpful to me. So, what is mindfulness? John Kabat-Zinn, who's the founder of the mindfulness-based stress reduction program out of University of Massachusetts, has my favorite definition. He says it's the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. That means just slowing down to the here and now and letting whatever you are feeling or experiencing simply be as it is without trying to change it, without judging it. Sometimes when we start getting stuck in the past and we keep thinking about what could have been and if things had been different, that's where the sadness and depression starts creeping in. And then when we start focusing on the things in the future, can I get pregnant? If I get pregnant, will it be okay? That's when the anxiety and the worry comes. But when you let go of the past and you stop thinking about the future and you turn your awareness on purpose to what is right here, you may find that is a very safe place for you to explore and be present. Mindfulness is a quality, it's a state of being. It fosters a sense of curiosity, awareness, engagement, and wakefulness to what's going on right now. It can be learn just like any other skill. So if you think about, if you want to strengthen your bicep, you go to the gym and you do some bicep curls. You're not going to get a stronger arm in one session. But if you do it multiple times a week over the course of 6 to 8 weeks, you'll find that bicep gets stronger. Mindfulness for your brain is no different. And it's about just training yourself to be right here, right now. Mindfulness practice can be divide it into formal practice and informal practice. So, meditation and yoga would be examples of formal practice. And informal practice, for those of us who are really busy and need to sneak it in, you can mindfully bathe, do your dishes, or eat a meal. So, mindfulness for grief. I want you to think about grief or any stressor that's going on in your life as being this salty blue ball in this really small container of water. And when you drop that salty ball into that container of water and you take a sip, it is just overwhelming and all consuming. And there is no space for anything else. Mindfulness helps grow that container for your stress or your grief. And with time, that container gets bigger and it almost has a dilution effect for that grief. The grief hasn't changed. The grief is still there. The event still happened. But that space that you are cultivating with your mindful practice gives you some space to process it, to step back, to give yourself some perspective, and to change your relationship to the loss. So, grief is a huge stressor. It impacts the mind, body, emotions, and your behavior. It can impact you from head to toe, physically, mentally, emotionally, spiritually. And unchecked grief, which is a stressor, can lead to burnout, depression, and suicide. So let's start looking for what the literature is telling us about mindfulness. I can only find one randomized control study that was published in 2021 about using mindfulness for pregnancy loss. So, meditation and mindfulness reduce perceived stress in women with recurrent pregnancy loss, a randomized control trial. This was a group out of Copenhagen, Denmark. And what they found in this 7-week mindfulness training that was about 10 to 20 minutes a day, they took about 150 people, divided them in half, and about 75 participants were doing the mindfulness, and the other 75 were journaling and just having standard care. And they found at the end of 7 weeks that the meditation group had a greater decrease in their perceived stress scale, both at 7 weeks, and then they had a slightly decrease in stress at 12 months. And they also noticed some benefits in their marriage. The Journal of Midwifery and Women's Health, they had a study, Are mindfulness-based interventions as effective as cognitive behavior therapy in reducing symptoms of complicated perinatal grief? And it was a systematic review. Unfortunately, they found that there is very few research articles there. And even though it looks like mindfulness based interventions can be as effective as cognitive behavioral therapy, we still need a lot more information, studies, and research. So, compassion. Mindfulness helps build compassion, which is empathy, kindness, and understanding for one's suffering. And this is the time to not only offer compassion for your colleagues who are going through this, but responding to your own suffering with that same empathy, kindness, and understanding that you would offer to a family member, friend, or colleague. So, compassion extends to fostering a culture change within our departments and our institutions. And I'd already touched upon this on some of what is being said in the literature, but the time off and flexible schedules and for infertility treatment and time off if you've had a loss. You may have been going through a lot of fertility treatments and had a miscarriage. It's reasonable to take a couple weeks off and start to process that loss. If you've had a stillbirth, taking your full maternity leave, 6 weeks if you've had a vaginal delivery, 8 weeks if you've had C-section, because your body is still going to go through all those hormonal changes. Your pelvic floor is still going to need to repair. Your milk is still going to come in, and you are going to need to tend to some very difficult emotions. And no, you may not be up with a baby, but you may be up with your grief, and insomnia is very common after loss. I also recommend decreasing your standing time. Something as simple as adding more chairs into our consultation rooms so that pregnant women can sit down. Reduce or eliminate call shifts at night and overnight shifts. And have a plan B for your schedule. In our department, it's pretty common the last couple of weeks of one of the CRNA's pregnancies to take them out of the schedule as a regular staff member in the OR and put them on breaks and lunches. And decrease exposure to environmental hazards by changing assignments. So, connection, this can be incredibly isolating and very difficult to talk about. And I had a hard time finding bereavement groups and support specifically for healthcare providers. There are a lot out there that are for anybody. But as providers, we are going back into the very institutions where we're experiencing our fertility treatments or have had our loss, and we are surrounded by triggers. Our colleagues may have been the very people who are taking care of us during loss. We may walk in and step onto the OB floor and immediately be triggered by what our experience was there. And just taking care of a pregnant patient or a newborn can be triggering. So, on the second Monday of every month, I offer a virtual support group with another CRNA who is in Toledo. Her name is Whitney Jablonski. And we simply come and we talk and we listen to any other healthcare provider who has experienced pregnancy and infant loss. And I also started a Facebook group. There was a physician in the Midwest. She a family practice, but did a lot of OB. And she's like, I can't go into any general Facebook groups and talk about my loss and talk about how I don't want to take care of OB patients because they are OB patients. So it allows us to talk about some of the things that are very unique to us as providers. I have also started a podcast to normalize difficult conversations, literally talking with other providers who've experienced this, and to also provide resources and some guided meditations for that mindfulness practice. So, when we talk about mindfulness, we can talk about it for hours on end, but until you experience it, you don't really know what it can do. So, I invite you all to wiggle a couple inches forward on your seat and create a little space between your back and the seat behind you. Place both feet flat on the floor and then place your palms on your thighs. I invite you to close your eyes and feel the weight of your body distribute evenly across your seat. Allow your awareness to notice your shoulders floating over your hips and the seat supporting the weight of your body. And then I want you to begin to let a softening wash over your face, releasing any gripping around your eyes. Allow your jaw to unhinge. Maybe you notice your lips parting. Allow your shoulders to slide away from your ears. a warmth to spread across your heart, and a softness to fill your belly. Notice the contact between your seat and the chair beneath you. And then notice where your feet make contact with the floor. Turn your awareness to your breath. Notice where your breath is most prominent in your body. Is it the feeling of the air moving through your nose? The expansion of your chest? Or the soft rise and fall of your belly? If you notice your mind drifting off and having thoughts, simply label them thoughts and turn your awareness back to the point in your body where you most notice your breath. When you're ready, slowly open your eyes. Take in a little sense of awareness of your surroundings, and then thank yourself for this little mini mindfulness practice to close out our talk. John Kabat-Zinn said, "You can't stop the waves, but you can learn to surf." And there are things that are difficult that we deal with, and it's learning how to deal with them and changing our relationship that helps us to get through them. If you or somebody you know has gone through a loss, I welcome you to join me in the Pause to Remember community or direct that friend towards the Pause to Remember community. Thank you. So I'm going to do a guided meditation, a visualization with you, and I'll do it over the course of the next 4 to 5 minutes. Okay. So everybody go ahead, sit back down in your seat. When you put a little space between your back and the seat behind you, it just gives you a little more space and purposefulness in your posture, feet flat on the floor, palms on your thighs. And I invite you to close your eyes. And I want you to think about a warm August afternoon sitting on the beach. And as you lay on the beach, you can feel the rays of sunshine above you, cascading over your body. Maybe you hear the sound of the waves crashing onto the shore as the tide begins to roll in. The seagulls above are chattering away with each other, and the smell of the sweet ocean air comes into your awareness. I want you to think about either sitting on your beach chair or laying on your beach towel, and either rubbing your feet down into the sand or snuggling your body into the sand, allowing it to cradle you. And if you were to take this sunshine and turn it into liquid rays of sunlight, think about that liquid sunlight pouring through the crown of your head and beginning to fill your body. And the liquid sunlight cascades down through your body to your left foot, creating a sense of warmth, heaviness, and softness in that left foot. Think about the liquid sunlight pooling in the left foot and then traveling up your left leg to your left knee, and then up, washing over your left thigh, wrapping around to the back of your left leg and up to your seat. So your left leg is now warm, soft, and heavy. Redirect your awareness to your right foot, allowing that liquid sunlight to pool in your right foot. Think about the warmth and heaviness there. And then as the liquid sunlight continues to pool in the right foot, it travels up your right leg to your right knee and covers your right thigh, wrapping around to the back of your right leg and up to your seat. Your right leg is now warm, soft, and heavy. Think of that liquid sunlight filling your pelvic floor and then cascading up, filling your belly and your lower back. The warmth of that sunlight continues to grow up to the middle of your back and then spreads across your shoulder blades, wrapping itself around to the front of your body, warming your heart and your chest. The liquid sunlight continues to pour through your crown and down into your left arm, making your left hand warm, soft, and heavy. Allow the liquid sunlight to travel up your left arm to your elbow and your shoulder. Your left arm is now warm, soft, and heavy. Feel the liquid sunlight now pooling in your right hand, traveling up to your right elbow and shoulder. Your right arm now feels the same as your left, warm, soft, heavy. Feel the warmth of that sunlight fill your head, maybe a little widening between your ears with the warmth and softness. Allow it to wash over your face, melting your cheek, releasing gripping around your eyes and unfurrowing your brow. Everything now, from the crown of your head to the tips of your toes, is warm, soft, and heavy. I invite you to just pause here, lingering for just a moment, and think about taking this feeling from your practice and carrying it with you into your day. Open your eyes. Thank you, everybody, for this opportunity to share. I just feel honored to be here with you all.